I'm Georgie, lovely to be here with everybody today. I'm physically with Kath, so I'm going to have the screen to me first, then turn it to Siobhan, who's going to present, and then Kath will present as well. So we've introduced ourselves, that's the first stage, isn't it? And we're here today to tell you about the Building Babies Brain approach, and particularly how it's been informed by research done by Siobhan and by Kath. So Siobhan's piece was initially part of the design and development phase, and then Kath came in as the approach reached a level of maturity. But I'm going to start us off and tell you about the approach itself. So it's a 7-session approach that totals 15 hours, and it enables community champions to do more with what they already know. The idea behind it is to empower trusted messengers who see parents and carers in their everyday places to gently share accessible, engaging and freely available resources about the first 1001 days. Our approach is evidence-informed, and all content for champions to share is evidence-based. So we draw on excellent resources that are created with parents in mind. And our community champions come from wide and varied backgrounds. So they might be a toddler group lead, a church group lead, foster carers, librarians, the list goes on. It's very inclusive, and it's about who those trusted messengers are in a particular community. It's preventative and early intervention in terms of signposting to services. And generally, we've offered it in locations where there might be considered a higher level of need, identified with the aim of reaching those who might be considered hardly reached or under-resourced. So the content includes information about the first 1001 days and brain development, attachment, early communication, tools and strategies for being in relationship. And our aim is to build a network of community champions. And as I mentioned, they're the trusted messengers in their community and aware of the parent-friendly resources that are out there that are evidence-based and can share important and key messages. It came about in response to Devon Children's Centres moving away from universal provision in 2018, combined with an awareness that many people didn't know the crucial information about that first 1001 days period. And we felt this reduction in services created a potential missed opportunity for some parents to have access to this information. We involved service users in development right from the start. We had a workshop with 14 parents attending, and with them we explored gaps left by this service change, the information they felt parents wanted and how it might be best provided. And hearing about their experience of our service and how they might want things to be different within a new service helped us to shape this programme. So it offered training out to those people parents might be considered trusted messengers. So I've mentioned many, but it also included, for example, breastfeeding peer supporters, Home Start volunteers, and supported our thinking about who parents might turn to. So we then set about creating an asset-based approach framed around values of all our business and supporting community champions to do more with what they already know. One of the features about our approach that we think might be unique is this idea of pass it on, which is based on diffusions of innovation theory. And we like to think about it as planting a seed or a whisper in the ear. So it's a subtle alongside approach that's reassuring for those who are receiving it. And this, we hear from community champions, is what helps make it work. So diffusions of innovation is a research model that describes how a new idea, product, positive health behaviour spreads through a community or social structure through key individuals. And we've termed pass it on as a way to encapsulate what we're suggesting champions might be doing, to pass on key messages and gentle signposting to trusted and credible sources of information and services. So this slide is just a snapshot of some of our logic model. You might not be able to see it if it's on a small screen, but it was developed in the very initial stages from stakeholder feedback and in consultation with Exeter University, and that was Dr. Jenny Lloyd, who works with both Kath and Siobhan. And it helped us think about the theory of how the approach might work and ways to explore potential impact. So I've mentioned underpinning research is diffusions of innovation, knowledge mobilisation as well, cognitive social learning theory, attachment theory, and increasingly the literature that's out there around community champions and the impact that they can make. And this is where I'm going to pass over to Siobhan so she can tell you about her study. And hopefully, can you move the slides, Siobhan? If I do that one, I'm hoping you might be able to move them. Otherwise, just say next slide.
All right,
please.
so I've moved them forward. Does that work for you? I'm back.
I'm on initial study. What are you on?
Oh, okay. I don't think it's moving then. So I'll just say next slide. Is that all right?
Yeah, definitely.
All right. Sorry about that, guys. Hi, I'm Siobhan, research fellow from University of Exeter. So as Georgie mentioned, the approach was first piloted in 2 places in Devon, and we were commissioned by Action for Children to do some research to understand the experiences of the community champions involved in this pilot project. Next slide, please. So we carried out some short semi-structured interviews over the phone with 15 community champions. We were exploring their motivations for volunteering and getting involved, their experiences of the training and their experiences of passing on messages in their community, and also their recommendations for training and support. Next slide, please. So as I said, we interviewed 15 community champions. They were from a variety of backgrounds and roles within their community. So this included toddler group leads, foster carers, home start staff, community group leads, breastfeeding peer supporters, a whole range of different roles there. And all of the participants had completed community champion training within the last 2 years. And in terms of their experience as community champions, some of them had years of experience outside of the training for this specific role, and others only had a few months. So there was a real range there. I'm going to briefly talk through the findings on community champion motivations and experiences of the training before I talk through a bit more detail about passing on the messages. So if we can go back 1 slide, sorry. In terms of their motivations for engaging in the training, this revolved around upskilling themselves within their current role. So whether that was as a parent or in a job or a community role, they wanted to enhance the help they could offer within that. And many of them had backgrounds in child development or early years work as well. And in terms of their experience of the training, that was largely positive. Most of them felt that the training prepared them well for the role. And they were really positive about the way in which the training was delivered. So particularly the way that the facilitators created a positive group dynamic and a kind of safe space where they could learn. And so some of the ways that they did this was through things like icebreakers, sharing of experiences, and these kinds of ways and these kind of tools were thought to be particularly valuable in understanding the perspective of the child within the training. And in terms of the training content, although most of the champions felt that the training prepared them well for the role, their feedback was quite varied based on their previous experience or knowledge in this space. So, for example, some of them described struggling with the brain development content, and others described having less experience of that kind of pass it on champion type role, and so they wanted more of a focus on that within the training. All right, next slide, please. So our champions described both successes and failures, successes and challenges in terms of passing on messages in their community. And the challenges really focused around where they were based within their community. who they could pass messages on to, and what messages they were passing on. So in terms of barriers for them, a lack of opportunities to pass on messages was a significant one. And this often stemmed from a lack of access to appropriate settings or changes to their community involvement. So, for example, maybe they used to go along to a toddler group, but now the child is older. So champions needed to be regularly active in their community setting in order to have that consistent interaction needed to build those relationships and pass messages on. And some of the champions reflected that the main challenge was around approaching someone who's struggling, someone who needs help. So some examples of challenging interactions included where family members offered conflicting advice, or when they were approaching someone with a fixed mindset, as you can see in the quote in the bottom left-hand corner. And they also felt that some content was harder to pass on than other content. So, for example, they tended to feel quite confident passing on tasks, signposting, modelling different behaviours, but less confident passing on specific kind of science-based knowledge. Next slide, please. So in terms of the successful experiences, champions described how their ability to pass on messages was supported by creating a receptive context, which involved building relationships with parents through a series of phases that you can see in the diagram on the slide. So community champions really emphasised the importance of the relational aspect of their role, and building and growing this network and the relationships within that network in which messages could be passed on. So offering practical help was often used to initiate that relationship with a parent, so attending to whatever was needed in the moment, and then being sensitive and waiting for an opening, gauging parent readiness was described as the next stage. So champions described this process of gauging the moment or testing the water, often by using verbal cues. And they would then use empathy or sympathy to kind of get alongside the parent, trying to be sensitive to whatever the parent was struggling with and normalising that. And then being supportive, offering praise and validation was described as something which could really cement and help to build that relationship further. And this was described by one participant as providing a magnifying glass to focus on the good stuff. And last but not least, we have revisiting. So this was an important part of passing on messages successfully. And a common approach was to kind of drip feed information throughout the process of building that relationship with the parent. Next slide, please. So our findings have implications for a few different areas. Selecting, identifying champions was a key one, wraparound support and further resources as well. And all of these things are fed back into the programme, which Georgie is going to speak to in a little bit more detail later. Next slide, please. And if you want some more of the details, I've given you a bit of a whistle-stop tour of that piece of work. We've got a little paper published in Perspectives in Public Health. And I'm now going to pass you on to Kath, who's going to talk about how this built from here.
Thanks, Siobhan. Yeah, good afternoon, everyone. So I'm going to talk about the next piece of research following on from that Siobhan led. So just to situate this in context, Siobhan undertook that piece of work a couple of years into the programme. A couple of years later, a lot more champions have been trained across Devon from varying different roles. So whilst we had an idea about how it worked in practice and the kind of facilitators and barriers to how it was working, we were really interested in finding out how that differs between different champions depending on their role in the community. So we wanted to investigate further the factors that influence this passing on of information to parents and why. So exploring a bit more about that receptive context that Siobhan highlighted already. So we wanted to investigate more about when and how information transfer or knowledge mobilisation happens, how this differs depending on who the champion is. So in terms of their traits, their characteristics, but also in terms of how they come into contact with parents in the community. So what their role is, their relationship with parents, and how all these things impact on how the approach works in practice. So we undertook an online survey and some online interviews as well to kind of try and get at some of these, answer some of these questions. So our sample included champions from all of the 16 training cohorts that happened by this point. So this was over 4 years of delivery of this training. And it covered 11 areas of Devon, which is broadly, I think, most of the areas that had been involved. So champions who attended the training held various roles in their communities. We separated them broadly into 3 categories for the purposes of the analyses. So we had professionals. These are people who, champions who come into contact with parents, usually through a paid position. So they might be working in schools, in childcare settings, local councils, charities, NHS, public libraries, foster carers, those kind of paid roles. We also had group leaders, so these were broadly people who were running community groups, so there's like the toddler group leads or church groups, those sorts of things, and then peers, so just other parents in the community. So they may be qualified peer supporters, like breastfeeding peer supporters, but they didn't have a kind of specific role like a group lead or a profession in terms of supporting parents. And there's an acknowledgement, obviously, that some of the professionals and group leads were also parents themselves. So that's just worth bearing in mind. So in terms of data analysis, what we did was we identified a number of themes in the data through exploring kind of what works with regard to this, for who, and what circumstances and how. So this kind of took a realist informed methodological approach to the analyses to really help us understand how and why a community champion approach to sharing evidence-based information works or doesn't work in kind of an early years parenting support setting. So just to go through some of the findings, so they're summarised in 5 kind of broad overlapping themes. So first was around the information sharing opportunities champions had. So this links back to some of the findings from the initial study. Interestingly, I mean, you'd expect that this varied depending on the role that the champion had in the community, whether they were coming into contact with parents regularly or not. So irregular interactions with parents were seen as an obvious barrier to information sharing, which you can imagine. So in thinking about the different roles, so the peers and group lead champions were most likely to have this regular interaction with parents, and importantly, the same parents within a community. So that really enabled this kind of relationship building between champions and parents. And also these things were associated with drip feeding information to parents over time in quite a sort of naturalistic, non-directive way. So that also impacted on the way in which the information was being shared. So we can see from this theme that the regularity of the champion parent contact not only impacts on champions' opportunity to share information, but also on their ability to form those all-important relationships with parents and the strategies they're able to use to share that information. So we also identified a theme around the relevance of the information being shared with parents. So again, the regularity of those interactions between champions and parents really impacted on not just the information being able to be shared, but also on the relevance of that information being shared as well. So another thing, champion characteristics, including sort of their knowledge, their confidence, was also something highlighted as determining factor in terms of their ability to appropriately tailor the information to individual parents. And so we come back to this a little bit later in terms of individual champion characteristics and the part that that plays. So the third theme was around champion-parent relationship. Again, this was highlighted in the initial bit of research, but we look into it in a bit more detail here. So here we can see the importance of a pre-existing, positive and trusting champion-parent relationship for enabling effective information sharing. So this relationship was also linked to parent receptiveness, with the parent being more receptive to information they were being told if that relationship was already in place. So there were also things we found that could impact on champions' ability to form these relationships with parents, such as those champion characteristics, being friendly and approachable, but also their ways of building these relationships. So for example, non-professionals, so that includes the peers and group leads, often reported the way that they actually built these relationships with parents was around maybe sharing personal information about themselves, about their lives and their parenting journeys, to kind of become trusted acquaintances with parents over a period of time. So you'll already see there's some kind of overlaps between these themes coming up, and we would absolutely expect that given the complex nature of how this approach works in practice and the various factors at play here. So an interesting difference between professional and non-professional champions came up regarding the expectation of that champion-parent interaction. So with professionals, parents often expect information to be given in that interaction. So it's not necessarily that difficult for champions to bring up kind of evidence-based information that they wish to share within that conversation with a parent. And as a result, professionals are also then fairly confident in doing that, in sharing that information. So conversely, some non-professionals found that actually steering a conversation with a parent in order to share evidence-based information could sometimes be really challenging, especially if they kind of lack confidence in that information, or in generally having those kind of interactions and conversations with parents more generally, or when they lacked that sort of pre-existing relationship with the parent and they didn't know them very well. So kind of non-professionals therefore reported using strategies to share information that were a bit more natural, kind of including things like modelling, reinforcing positive parent behaviour and those kinds of things. So, I mean, what this tells us is that who the champions are in terms of their role in the community really impacted on both their confidence in sharing information with parents, but also the ways in which they did that, so the strategies they used to share that information. So the final theme here is around the champions themselves in terms of champion confidence. So we've already learned that confidence helps champions engage with parents and share that information to form relationships with them and also tailor the information appropriate for each parent they're talking to. So it kind of follows then that confidence was considered a lot more important by the champions we spoke to than the actual role that the champion held in the community. So this confidence was a really big thing, seemed to be really important. So, I mean, on the whole then, champions interacting with parents regularly were more confident, and over time this confidence increased with practice, with reinforcement from parents. Professional champions were more confident sharing information than non-professionals. Non-professionals often said this was because they weren't really sure how to deal with some questions that parents might pose or challenges in beliefs, and that was a real tricky bit for them. This difference in confidence also impacted on the strategies they used to share information and also on the actual information being shared. So, for example, non-professional champions reported sharing information that was most easily explained. So things around kind of the importance of what we call serve and return parent-child interactions, rather than maybe talking about kind of brain development and neuroscience with regards to child development, which you can imagine is quite difficult to bring up in a natural conversation for some, perhaps. So together these themes demonstrate what is considered important for champions to enable them to effectively pass on information to parents, and how this can differ depending on the champion personal characteristics, as well as what their role is in the community and how the nature of that interaction with parents, so whether they're professionals or non-professionals. And it also shows us how these factors can impact on the strategies that they use to share the information, so the ways in which they're doing that. So this is a really small, very busy figure, which I'm not expecting you to read, but broadly, kind of, I put it up mainly just to show, sort of demonstrate the complexity of the pathways of impact. So if we think about, on the left here, we've got sort of equipping champions with evidence-based knowledge around parenting and child development. And on the right-hand side, parents being exposed to the evidence-based information. we talk about kind of the yellow boxes are all around the different contextual factors at play here. The red are around the mechanisms of change. They're the things that kind of drive the change or the leading to champions being able to pass on that information, and the outcomes are in blue. You can kind of see the complex nature of how this plays out. So it kind of just showing this helps to hopefully demonstrate like the overlapping nature of the pathways, the fact there's kind of some rippling effects, which we call where one outcome can become a new context and so on. And in general, just the complexity of how this works in practice when you consider all of the different differences there might be in a real world situation in terms of the context, the champion, the parent, and those relationships between them. So quite broadly, I suppose, then the research really helped to develop and refine a theory, I suppose, for how community champions can be used to share evidence-based information with parents and communities to support parent-child relationships and ultimately long-term child development outcomes, including where and when and for who this approach might work best or most effectively. So it helps us to understand how and why professional and non-professional champions share information differently, and the impact this might have on how well this model might work in a practice setting. So importantly, it also, I think, highlights some benefits, some key benefits for including peers, so that's non-professionals, as champions, notably things around them being part of the target population that you're trying to reach, the parent population. Non-professionals often have a lot more time to get to know parents and to develop those positive, trusting relationships, which we know are key for this information sharing. And they're able to use strategies like drip feeding relevant information over time. They can model and reinforce positive parenting behaviour and use those kind of other strengths-based approaches to supporting parenting, which we know are really important. So perhaps most importantly with regards to this research are the implications it has for practice and for those designing, delivering public health interventions using community champions as a way of supporting parents with young children. So the key areas for consideration from this research are around champion selection. So it's really important to consider things around champion traits and characteristics and how regularly they may come into contact with the same parents in their role in the community to determine how effective this approach might be. To think about champion training, so addressing some of those challenges, particularly for non-professionals around their confidence in sharing information, in interacting with parents, and being able to steer conversations to be able to share that all-important evidence-based information. And also strategies for engaging parents too. How do you bring that information up, and how do you engage a parent in conversation? And also thinking about ongoing training and other resources or support needed to help champions with their confidence with regards to that. And in addition, thinking about how best to support this approach moving forward to ensure it's both practical to implement at a larger scale and sustainable. And Georgie can talk a little bit more to that in a moment now when she talks about where the program's come since this research and where it's going. So that's it from me. This research has been written in paper as well. So there's another paper here which is open for anyone to view. It's freely accessible. There's a link there which you probably won't be able to click on, but I can pop it in the chat for anyone who's interested. And so I'm just going to pass back to Georgie now to talk about the impact of the research that Siobhan and I have done and the next steps for the programme going forward. Thank you.
Thank you, Kath. So I just want to spend a few minutes, as Kath has mentioned, talking about the impacts of the research, and time allowing, I hope to just share with you some voices of champions themselves. So the studies that you've just heard about have contributed to the development and the continuation of building babies' brains. And I think I probably can't overstate how much difference that has made to us. So we've been able to use the findings and the recommendations to make a number of adaptations, and I'll just give a couple of examples briefly. So we added in 2 extra sessions, lengthening it to 7 sessions from 5 sessions, to spend more time looking at some of the content, more time looking at strategies, more time thinking about how we can work alongside the champions to build their confidence. And we produced new resources. This summer, Kath joined a facilitator session to share some of her key messages from her research directly with those who lead the programme. Obviously, it gave them the chance to speak directly with her and ask questions. So they were able to go away and consider how they'd scaffold further learning around how champions can facilitate conversations, think about strategies and build their confidence. You heard there about how different groups of people have received and taken the training on. So we are considering recruiting differently and training differently, whether we perhaps have a group of the training for workforce, for professionals, and a group more aimed at volunteers. And there's a payoff there, isn't there, between how you can bring together a network of people within a small community, and we hear from our champions how important that is for them, but then you might lose something in the training that you offer and how that develops their confidence. We've increased our offer of additional update training to champions. So later this month, we've got half-a-day training by Dr. Amanda Lucas from Baby Grow in Cornwall. So we keep keeping in mind, how do we stay in touch with our champions? How do we give them extra information? We also have a quarterly newsletter, regular Facebook posts, and a learning platform that they can freely access with all the information on that. And the papers that Siobhan and Kath showed you, we've done accessible versions of both of those to share with champions and commissioners as well. So the studies have provided independent input for the design and development team and the facilitators to look at those enablers and barriers to support champions sharing information with parents, and the publication of the research papers has helped raise the profile of the approach both within Action for Children, the organisation I work for, and the county councils that we've offered the programme out in. I'll talk briefly a little bit more about that in the moment. So in the southwest, that's Devon, Torbay and Plymouth, Building Babies' Brains is being rolled out as part of the Family Hub approach. So we've trained up 250 champions, and that includes our training in Wales and Bath as well. We've just got 10 more programmes running at the moment, so we'll be up to over 300 champions by December this year. So looking ahead to 2025, we're looking at how we sustain the programme and potential ways that we might be able to scale up. And with Plymouth Family Hub, an Action for Children service alongside other services, we're in the process of developing a parent model of the approach, very early stages of that process. And one of the things that for me has really kept the research alive and really strengthened that opportunity to continue linking in with Kath and Siobhan has been a fellowship funded by the National Institute of Health Research. So I combine 50% of my work time and 50% is research time, and that's for a PLAF, a pre-doctoral local authority fellowship. Not so easy to say. And the aim of the award is to develop practitioner academic skills, to keep bringing research into practice, and longer term to look at the development of a PhD application. But at the moment, what it really does is keep adding research to the programme. As part of that, Kath and I have a steering group of community champions to keep helping stakeholder involvement in shaping research ideas and around looking at parenting interventions as well. It's given me, the fellowship has given me access to peer support team, so Kath and Leah Atwell at the University of Exeter as well, and my research focuses on how to best share knowledge and support parents in community settings to promote positive baby interactions and ultimately parent and child well-being. Did you want to say about your research focus? So Kath's research focus is just taking a strengths-based approach to parenting and learning from evidence-based programmes, parents and communities to co-produce a framework for the next generation. And I want to just finish off sharing a video of champions' voices. So you'll hear from 3 champions who've trained with us, 2 in Devon and 1 in Bath. And it is about 6 minutes long, but I wanted to really give the opportunity to hear from their voices. So fingers crossed, it will work for you.